Hi there, and welcome. My name is Jenna at Dr. Hansen's office. If you're someone struggling with chronic knee pain, whether from osteoarthritis, meniscus degeneration, or overuse injuries, you've probably been told that your only real options are injections, medications, or surgery. But today, I want to introduce you to two powerful, research-backed therapies that are changing the game: knee decompression therapy and shockwave therapy. Both are non-invasive, and when used together, they're helping patients reduce pain, improve function, and in many cases, avoid surgery entirely. Let's dive into what the research actually says. Knee decompression therapy is a mechanical treatment designed to gently stretch and separate the joint surfaces of the knee. This decompressive force reduces joint pressure, promotes fluid exchange, and helps restore proper joint spacing and tracking. You can think of it like spinal decompression therapy, which has long been used to treat disc injuries. But now that same concept is being applied to the knee. So how does this help? 1. Reduces compressive load. Osteoarthritis and meniscal degeneration often involve excessive compressive forces across the tibiofemoral joint. Decompression helps reduce that stress, which may slow down further degeneration. 2. Improves synovial fluid circulation. The intermittent stretching motion encourages joint lubrication and nutrient delivery, crucial in joints with limited blood supply. 3. Stimulates mechanoreceptors. This helps with proprioception, how your brain senses joint movement, which is often disrupted in chronic knee pain conditions. Research behind it. A 2021 pilot study published in Journal of Physical Therapy Science found that knee decompression traction, when applied for 4 weeks in patients with knee osteoarthritis, resulted in significant improvements in pain scores and function, as measured by the WOMAC index. A 2020 clinical trial compared decompression plus physical therapy versus physical therapy alone. The decompression group had greater reductions in stiffness and better improvements in range of motion. While research is still emerging, we're seeing promising data that decompression improves biomechanics, reduces inflammation, and enhances joint space over time. Now let's talk about shockwave therapy, also known as extracorporeal shockwave therapy, ESWT. This isn't electrical stimulation, it's a mechanical acoustic wave that penetrates deep into tissues. There are 2 types: radial shockwave, more superficial, spreads outward; focused shockwave, deeper and more targeted. Shockwave therapy has been used for years to break up kidney stones, but in orthopedics, it's shown incredible promise for tendinopathies, plantar fasciitis, and now chronic knee conditions. Mechanisms of action. 1. Stimulates angiogenesis. It promotes the formation of new blood vessels, especially in degenerated or poorly perfused tissue. 2. Breaks up scar tissue and calcification, especially valuable in chronic tendon overload. 3. Reduces substance P and other pain mediators, so it not only repairs tissue, but actively reduces pain. 4. Stimulates stem cells and repairs signaling pathways. Clinical evidence. A 2022 systematic review published in Clinical Rehabilitation examined 10 randomized controlled trials and found that shockwave therapy led to significant pain relief and functional improvement in knee osteoarthritis, especially when combined with exercise. A 2018 RCT in the American Journal of Physical Medicine and Rehabilitation showed that just 3 sessions of focused ESWT reduced VAS pain scores by over 40% in chronic knee pain patients, and those effects lasted for at least 12 weeks. A 2020 study in Archives of Physical Medicine and Rehabilitation demonstrated that shockwave therapy improved cartilage thickness and quality as measured by ultrasound in patients with medial compartment knee OA. So not only is it reducing pain, it may be stimulating actual tissue regeneration. Here's where it gets really interesting. On their own, knee decompression and shockwave therapy are effective, but combined, they offer a biomechanical plus biological approach. Decompression unloads the joint, improves joint motion, and restores fluid exchange. Shockwave triggers tissue healing, vascularization, and pain relief. We use this combination in our clinic because decompression improves the environment around the joint, while shockwave improves the environment within the joint and its supporting tissues, like the tendons, ligaments, and joint capsule. For example, a patient with knee OA and chronic patellar tendinopathy would receive decompression to reduce joint load and realign mechanics, and shockwave to stimulate healing in the tendon and reduce inflammation. In a 2023 observational study, patients who received combined therapy had faster recovery times, better pain relief, and longer-lasting outcomes than those using only one modality. And while more large-scale studies are needed, the anecdotal and clinical success stories keep piling up. Knee decompression and shockwave therapy can be beneficial for osteoarthritis, mild to moderate, chronic meniscus issues, patellofemoral syndrome, chondromalacia, patellar or quadriceps tendinopathy, post-surgical stiffness or scar tissue. It's especially useful for patients trying to avoid knee replacement or for younger athletes recovering from repetitive strain injuries. That said, it may not be suitable for complete ligament ruptures, advanced bone-on-bone osteoarthritis, active infections, or malignancies near the treatment site. So if you've been told surgery is your only option, or if injections have only offered short-term relief, it might be time to look into this approach. Knee decompression and shockwave therapy represent a new frontier in non-invasive regenerative care. Backed by promising research and supported by real-world outcomes, this combination gives people their mobility and their lives back. Thanks for listening, and if you have questions about whether this is right for you, feel free to reach out. We're here to help. Give us a call at 801-449-0313